Have you ever stopped to think that, well, something as seemingly simple as a newborn calf's belly button could actually be a huge deal, like a potential time bomb causing massive problems for farmers?
It sounds almost too simple, doesn't it? But it's surprisingly complex.
Yeah, and today we're diving into exactly that, a condition that's often underestimated but can be uh, economically devastating. We're talking about navel ill in calves. You might also hear it called omphalitis or maybe
Or
omphalophlebitis.
even joint ill. That's another common name for one of the complications. It's basically a significant infectious disease hitting calves right after birth, usually within that first week.
Okay.
And what's really striking is how a bacterial entry through that umbilical cord, that navel, can escalate. It starts local, but it can quickly become a severe, widespread issue.
Throughout the whole calf.
Exactly. And understanding this, even though it seems like a niche topic, it has really broad implications for animal welfare, definitely, but also crucially for agricultural economics.
Yeah.
It hits the producer's bottom line hard.
Right. So our goal today in this deep dive is to really cut through the details and the sources you've looked at and pull out the absolute essentials. What is navel ill? What's its real cost? What causes it? How do we spot it? How do we treat it? And maybe most importantly, how do we actually prevent it? So let's start right there. What actually is navel ill when it first shows up? What are we looking at initially?
Well, at the very beginning, it's often just inflammation or infection right around the umbilical remnants, the bit left after birth.
Just a swollen belly button.
Pretty much. You'll often see it as just a localized swelling of that umbilical stump.
Yeah.
But, and this is the critical part, if that initial infection isn't caught or managed properly, it doesn't stay local for long.
Okay.
The bacteria can use those umbilical vessels like little highways. They spread through the bloodstream to, well, all sorts of distant organs.
And that leads to what kind of problems?
Really severe complications. Things like infectious polyarthritis, that's the joint ill people talk about, where multiple joints get inflamed and painful. Or you can get liver abscesses, peritonitis, which is a nasty infection in the abdomen, even meningitis,
Wow.
and generalized septicemia, which is basically blood poisoning, a full-body infection. So, yeah, this progression means navel ill is a major contributor to both sickness, morbidity, and unfortunately, death, mortality in young calves.
And it's not just the tragedy of losing a calf, is it? You mentioned the economics. This condition carries a really significant, maybe surprisingly significant financial weight for producers.
Absolutely. You've got the direct cost of calf mortality, obviously. Then there's the fact that you might have to cull calves with those crippling joint infections because they just won't thrive.
They can't recover.
Often not fully, no.
Huh.
And even for the ones that do survive, you often see substantial reductions in their weight gain. They just don't grow as well.
Okay, so reduced productivity right from the start.
Exactly. And if you dig a bit deeper, the economic picture gets even more concerning. Chronic infections, even low-grade ones, can cause long-term issues.
Like what?
Well, for instance, we've seen infections pop up in the secondary sex glands of bull calves. Now, that might not show up for months, but it can potentially lead to infertility down the line.
Wow, so a problem that started at the navel weeks or months earlier could affect breeding potential later on.
Precisely. And that's another layer of economic loss that might not even get traced back to that initial navel infection. It's often hidden.
Which brings us to something really interesting. You mentioned this huge potential for underestimation. The actual prevalence on farms might be anywhere from 5% to maybe 34%, which is massive. But farmers often report treating much lower numbers, sometimes like 4.5%. Why such a big gap?
That disparity, yeah, it's largely because a significant chunk of these cases are subclinical.
Meaning no obvious signs.
Exactly. The infection is spreading internally, but the outside of the navel might look okay or only slightly off. Think about omphalophlebitis, that infection of the umbilical vein we talked about.
Right, the one going to the liver.
Yes, it can extend all the way to the liver, maybe form abscesses there without any immediate, really obvious external symptoms on the navel itself. So it's incredibly hard for a producer just doing daily checks to recognize it.
So these hidden infections are just simmering away.
Pretty much. And if these subclinical infections are insidiously causing reduced growth rates later, or that future infertility we discussed, then the total economic hit is almost certainly far, far greater than what we estimate just by looking at the calves needing obvious treatment.
That really highlights a gap, doesn't it, in just sort of day-to-day farm management and maybe diagnostics.
It really does. It suggests we're potentially missing a lot. It's like a stealth problem, quietly costing farms potentially millions in damage that isn't always visible.
Okay, let's rewind a bit. How does this whole process start? How does the navel become such a weak point? You said the umbilical cord at birth is like an open door for bacteria.
That's the absolute core vulnerability. Right after birth, the structures within the cord, specifically the umbilical vein and the urachus, can stay patent, meaning open for several days.
They don't close up immediately?
Not always, no. And the umbilical vein is particularly susceptible. It's got a wider opening, a bigger lumen, and its muscular wall is weaker compared to the umbilical arteries. So it's easier for things to get in and stay open.
And then what happens?
Well, to make matters worse, you often get some coagulated blood trapped inside these vessels. And that blood provides a perfect, nutrient-rich environment for bacteria to grow.
Like a little petri dish?
Kinda, yeah. So you've got this open doorway, an ideal breeding ground inside, and then you've got opportunistic environmental pathogens just hanging around waiting for a chance to move in and multiply.
Okay. So what kind of bacteria are we actually talking about here? Who are these culprits causing all the trouble?
It's usually not just one type. These infections are typically polymicrobial, meaning a mix of different bacteria are involved.
A real gang of them.
You could say that. The usual suspects include things like E. coli, which is common in the gut environment, and also skin bacteria like Staphylococcus aureus, and various types of streptococcus, like Streptococcus bovis.
Okay.
You also very commonly find Truparella pyogenes that used to be called Arcanobacterium pyogenes and Fusobacterium necrophorum. Others pop up too, like Pastorella, Proteus, Actinomyces, even Clostridium tetani or Citrobacter.
So it's a broad mix. That must make treatment tricky.
It certainly complicates it, yeah, because you need something that's going to be effective against potentially several different types of bacteria at once.
Right. And speaking of complications, you mentioned different forms this infection can take. Can you break those down? Let's start with the more localized ones.
Sure, so the simplest form is probably omphalitis. That's basically a localized infection or maybe an abscess just in the tissues right around the umbilical stump itself.
So that's the swollen, painful navel we talked about.
Exactly.
Yeah.
Visibly swollen, painful, maybe hot to the touch, feels moist, doesn't dry out like it should. You might even see pus draining or a fistula, which is like a little abnormal opening.
Okay. Then what?
Then you have omphalophlebitis. That's specifically an infection of the umbilical vein. And this is the one we worry about because that vein leads directly to the liver. So the infection can travel right up into the liver, potentially causing abscesses there. And like we said, sometimes without much showing on the outside.
That's the sneaky one.
Definitely. Then there's omphalorheritis, which is infection of the umbilical arteries. We tend to
Mm-hmm.
see that less often than vein infections.
Okay.
And finally, urachnitis. That's an infection of the urachus, which is the tube that connects the bladder to the umbilical cord in the fetus. If that doesn't close properly and gets infected, it can lead to bladder problems, maybe secondary urinary tract infections too.
Okay, so those are the local or semi-local issues. But then you mentioned the really severe stuff, the systemic spread. How does that happen?
Right. If that initial infection isn't contained quickly, the bacteria basically break out into the bloodstream. That leads to bacteria in the blood or even full-blown generalized septicemia.
Blood poisoning.
Exactly. A widespread, life-threatening infection circulating everywhere.
Yeah.
And from the bloodstream, the bacteria can land almost anywhere.
Leading to.
Well, the most alarming and sadly quite common outcome is joint ill or infectious polyarthritis. The bacteria settle in the joints, often the fetlock, carpus or knee, hock, stifle causing severe swelling, stiffness, pain, obvious lameness. Sometimes you just see a calf with a really stiff, arched back way of walking.
That sounds awful. What else?
Another really dangerous one is peritonitis. That's when the infection spreads into the lining of the abdominal cavity. Calves with this tend to go downhill very fast. Their belly might look distended, and it's often fatal, sometimes within days. And you can get other severe complications too. Meningitis, infection of the brain lining, which is also often fatal, pneumonia, uveitis, which makes the eyes look cloudy, endocarditis, affecting the heart valves, even osteomyelitis, which is infection deep in the bone.
Wow, when you lay it all out like that, it really hits home. That umbilical cord isn't just some external bit, it's a direct pipeline, isn't it? Straight to vital internal organs, especially the liver.
That's exactly right.
So a seemingly small infection on the outside has this built-in potential to just explode into something severe, systemic, and life-threatening. It really is like a ticking time bomb for these little guys.
Precisely. It just underscores that these umbilical infections aren't some isolated little skin problem. They represent a central point of vulnerability that can compromise the calf's entire system. And often, like you said, it starts silently.
Okay. So it sounds like certain situations or certain calves are more at risk than others. What are the key risk factors here? What makes navel ill more likely to happen?
Yeah. There's definitely a whole web of factors that kind of interact. It's rarely just one thing.
Okay, like what?
Well, first up, you've got environmental and hygienic factors.
Mhm.
This is a big one. An unclean calving area, dirty, wet, maybe lots of flies, dramatically increases the number of bacteria the calf is exposed to right at birth.
Makes sense.
Poorly managed bedding, too, if it's damp or soiled where the calf rests. Overcrowding can contribute. Even just moving calves too soon to contaminated pens before their navel has properly sealed off, that all raises the risk.
So cleanliness is paramount.
Absolutely. Then you've got management practices, things the farmer does or doesn't do. Improper or delayed navel disinfection is obviously a critical one. You need to treat that navel stump quickly and effectively.
With what usually? Iodine.
Yeah, something like a strong iodine tincture, like 7%, is often recommended. But here's something really interesting and kind of counterintuitive.
Oh.
Clamping the navel stump. Put a clip on it. Many people might think that seals it off and protects it.
Yeah, that seems logical.
But actually, research suggests it can inadvertently trap bacteria inside, potentially making infections worse or harder to treat if they do start. So generally, clamping isn't recommended anymore.
Huh. Okay, that's good to know. What else under management?
Things like delayed separation of the calf from the dam in some systems can increase exposure. And dystocia, a difficult calving that's a major risk factor.
Why is that?
Because difficult births often result in weaker calves. They might be slower to stand, slower to nurse, and their immune system might be compromised right from the get-go, making them more vulnerable.
Okay. And then are there factors specific to the calf itself?
Definitely. The biggest one is probably inadequate colostrum intake. That first milk is packed with antibodies. If a calf doesn't get enough good quality colostrum soon enough, what we call failure of passive transfer, or FPT, its immune system is severely handicapped.
Making it an easy target for any bacteria around.
Exactly. Interestingly, bull calves seem to be at slightly higher risk, maybe 15–20% higher. Their navels tend to dry a bit slower.
Oh, really?
Yeah. And even the dam's condition plays a role. Her body condition score, or BCS. Calves born to dams that are either too thin or too fat, say, using the Holstein Brown Swiss scale, less than 2.75 or more than 3.75, those calves actually face about a 1.4 times higher risk of omphalitis.
Wow, so the mother's health directly impacts the calf's navel health risk.
It seems so, yeah. It's all interconnected.
That's a lot of pieces interacting. So if you step back and look at the big picture, these risk factors aren't really isolated points, are they? It sounds like a problem in one area can make things much worse somewhere else.
Absolutely. They form this complex, interconnected web.
Like you said, a dirty calving pen combined with a difficult birth.
Right, that leads to a weak calf. Maybe it doesn't get colostrum quickly. Its immunity is shot, and it's long in a contaminated environment. Bang, it's incredibly vulnerable to navel infection.
And that documented underreporting we talked about earlier, that's not just about numbers, is it? It points to maybe a lack of awareness or perhaps limitations in diagnosis on some farms, which in itself becomes another risk factor, right? Because if you're not catching it, you can't manage it.
That's a really crucial point. That lack of detection or awareness is in itself a critical management risk factor that allows the problem to persist and spread, often silently.
Okay, so let's say a farmer or a vet suspects navel ill. What should they be looking for? What are the key diagnostic signs?
Yeah, spotting it early is critical for successful treatment. There's several things to look for.
Go on.
First, obviously, navel area symptoms. Is the navel swollen? Does it feel painful or hot? Is it moist when it should be dry? Does it just seem like it's not drying up normally?
Obvious things first.
Right. You might see an actual abscess or some discharge, maybe pus or that fistula we mentioned. And sometimes just gently pinching or palpating the navel area can reveal some deeper swelling or pain that isn't immediately obvious just by looking.
Okay, so a hands-on check is important. What about signs the infection has spread?
Yes, systemic symptoms. These tell you it's likely moved beyond just the navel. Things like the calf being apathetic, dull, depressed, just lethargic, not wanting to eat, reluctant to suckle.
Just generally off.
Exactly. You might find a fever, usually over 39 degrees Celsius, or about 102.5 Fahrenheit. Though, interestingly, some really sick septic calves can actually become hypothermic if their temperature drops too low.
Right.
You might also notice their heart rate and breathing rate are consistently high. Sustained tachycardia and tachypnea.
Okay. What about the joints? You mentioned joint ill.
Yes, musculoskeletal signs, particularly related to joint ill. This is a big one. You look for swollen joints, often the fetlock, carpus, hock, stifle. They'll likely be stiff, maybe feel hot, and definitely painful.
Leading to lameness?
Obvious lameness, yeah.
Hmm.
Or that characteristic stiff, arched back posture when they try to walk. You can also see pretty rapid muscle wasting or atrophy
Mm-hmm.
around the affected joints.
Okay. Anything else?
Yeah, look out for other complications. Things like cloudy eyes, which is uveitis, abdominal distension, which could signal peritonitis, or in severe cases, neurological signs like head pressing, circling, or seizures suggesting meningitis, which again is often fatal.
Hmm.
Just generally, poor growth or failure to thrive can be a sign of a chronic, lingering infection.
That's a pretty comprehensive list. But what's striking is what you said earlier, that the external signs, while they're important clues, often don't tell the whole story, especially with those hidden internal infections. So what tools are really essential to get the full picture?
You're absolutely right. The external exam is just the starting point. While a thorough clinical exam, including that deep palpation we mentioned, is vital, it often isn't enough.
So what is enough?
This is where technology comes in. Ultrasonography, or UEC, is repeatedly highlighted in the sources as being fundamental, highly reliable, and frankly essential for diagnosing these conditions accurately.
Ultrasound for a calf's belly button.
Absolutely. Its utility is huge here. It lets you actually see inside. You can investigate if those internal structures, the umbilical vein or arteries or the urachus, are involved. You can clearly differentiate between something relatively simple, like an umbilical hernia, and a more serious abscess.
Okay.
Crucially, it identifies the precise extent of any internal infection. Is the umbilical vein just slightly enlarged, or is it massively dilated and full of pus extending right up to the liver? That information is critical.
And that helps decide treatment.
Exactly. It directly guides the choice of treatment, especially whether surgery is needed and what kind. There are even specific measurements vets look for on the ultrasound, like if the umbilical stump is wider than 20 millimeters, or the vein is wider than 15 millimeters on a first check, or still over 10 millimeters on a follow-up. Those numbers are strong indicators of significant internal infection, often justifying more aggressive intervention.
So ultrasound is key. What about lab tests?
Laboratory diagnostics also play a really important role. Blood tests can help confirm septicemia. You might get a positive blood culture, or see characteristic changes in the blood cells, like abnormal white blood cell counts, high fibrinogen indicating inflammation, maybe low globulin levels.
Okay.
And culturing fluid from an affected joint or pus from an abscess is also really valuable. It helps identify the specific bacteria causing the problem and, crucially, tells you which antibiotics they're susceptible to. That allows for more targeted treatment.
So putting it all together,
Yeah.
if a vet just looks at a calf, maybe feels the navel, they could easily miss a serious internal infection, right? Because the outside might look deceptively normal.
That's the core problem.
Yeah.
Especially with omphalitis, the internal damage can be severe and widespread, even with minimal external signs.
Which really underlines why relying just on traditional visual checks and palpation isn't enough for this condition.
Absolutely. It points to a real need for veterinary practices working with calves to prioritize having access to or investing in advanced imaging like ultrasonography and the training to use it effectively for this purpose. It's really a necessary evolution in how we diagnose these cases. It moves us beyond just observation to a much more precise, informed approach.
Which ultimately leads to better treatment decisions, better outcomes, and better welfare.
And better economics for the producer, too, by catching things early and treating appropriately.
Okay, so let's talk about treatment. If a calf is diagnosed, what are the options? It sounds like it really depends on what the ultrasound and maybe lab tests show.
Definitely. It's not a one-size-fits-all situation. The approach needs to be multifaceted and tailored to the specific diagnosis.
So what are the main pillars of treatment?
Broadly, you've got medical management and potentially surgical interventions.
Let's start with medical. What does that involve?
Medical management is often the first line, especially if caught early or if surgery isn't indicated yet. The cornerstone is antimicrobial therapy. Because these infections are often polymicrobial, you usually need to start with early, aggressive, broad-spectrum antibiotics.
But what kind?
Things like penicillin, streptomycin, oxytetracycline, or maybe newer ones like ceftriaxone are commonly used. The key is broad-spectrum initially, until you maybe get culture results back.
And how long do you treat for?
That's crucial. You need to continue treatment until all the clinical signs have completely disappeared, which might take a week, often longer. Stopping too soon is a recipe for relapse.
Okay. Antibiotics are key. What else?
Just as important is supportive care. Antibiotics fight the bugs, but the calf needs help recovering. This includes pain management, really important for welfare, and encouraging them to eat using anti-inflammatory drugs like meloxicam or flunixin-miglumin.
Makes sense, especially if joints are involved.
Absolutely. Fluid therapy is often needed, either oral electrolytes or intravenous fluids, sometimes with dextrose for energy. Nutritional support is vital. If the calf won't suckle, you might need to tube feed them, aiming for maybe 10–20% of their body weight per day in milk or replacer.
Wow, that's intensive.
It can be. For severe septicemia, plasma transfusions can help provide antibodies and proteins. Oxygen might be needed if they're hypoxic. And just good basic nursing care, keeping them warm, clean, dry, well-ventilated, it all helps.
Okay, so that's the medical side. When does surgery come into play?
Surgical interventions are often necessary for more severe, established, or contained infections, and the decision is heavily guided by those ultrasound findings.
What kind of surgery?
Well, for a simple localized naval abscess, it might just be drainage, lancing the abscess, and then flushing it out regularly with an antiseptic solution like 5% povidone iodine.
Yeah.
But for more complex, contained umbilical masses like an infected urachus or vein segment that's walled off, the gold standard treatment is often en-bloc resection. That means surgically removing the entire infected structure completely.
Taking the whole thing out.
Exactly. And the success rates for this, when done properly for the right cases, can be excellent. One study reported 100% survival.
That's impressive. What if the infection is really extensive, like that vein infection going deep into the liver? Can you still remove it all?
That's where it gets trickier. If you have severe omphalitis, where the umbilical vein is hugely dilated with pus, and that infection extends way up deep into the liver tissue itself, doing an en-bloc resection might be impossible or too risky.
So what do you do then?
In those specific severe cases, a procedure called umbilical vein marsupialization might be performed. Essentially, the surgeon creates an opening from the infected vein remnant directly to the skin surface, allowing the pus to continuously drain out over time. It's a way to manage deep liver involvement when removal isn't feasible.
Kind of like creating a permanent drain. Temporarily
Correct.
permanent, yeah, to allow healing from the inside out. So overall, the prognosis with surgery, even if the liver is involved but the infection is contained, can actually be quite good.
But
But the prognosis gets significantly worse if the infection is already spread widely. If you've got established polyarthritis in multiple joints or meningitis or diffuse peritonitis, those systemic complications are much, much harder to treat successfully even with aggressive therapy.
right, that makes perfect sense. So again, it really underscores that a one-size-fits-all treatment plan just won't cut it. You absolutely need that accurate diagnosis, especially from ultrasound, to know the extent of the problem and choose the right path, whether it's medical management, drainage, resection, or something else.
Precisely. Tailoring the treatment based on a precise diagnosis is absolutely essential for giving that calf the best chance.
Okay, this leads us, I think, to the most critical part of the whole discussion, prevention. Because it sounds like stopping this before it even starts is vastly better and probably way more economical than trying to fix it later. You are absolutely right. Prevention is, without a doubt, the most impactful and cost-effective approach. The real win is avoiding the infection in the first place.
So what does a comprehensive prevention strategy look like? What are the key pillars?
It really requires attention to detail across several areas.
Let's break it down.
First, optimizing the calving environment and calf hygiene. This is fundamental. You need a clean, dry, well-bedded area for cows to calve in. Minimize the time the newborn calf spends in that potentially contaminated maternity area.
Get them out quickly.
Ideally, yes, into their own clean, dry space. Calf pens or hutches need to be kept meticulously clean and dry, especially during that critical first week of life when the navel is still vulnerable. And don't forget, fly control flies can easily transport bacteria right to the navel stump.
Okay, hygiene first. What's next?
Effective colostrum management. We touched on this with risk factors, but it's central to prevention too. Ensuring timely, ideally within 2 hours, definitely within 6, and adequate intake of high-quality colostrum is non-negotiable.
How much is adequate?
Aiming for about 3 liters, or roughly 10% of body weight, in that first feeding is a common recommendation. And quality matters. You can assess it using tools like a Brix refractometer or checking total protein. If a calf is weak or slow to nurse, you need to assist feed, maybe with a tube feeder, to make sure it gets that vital colostrum.
Right, kickstarting that immunity. Then what about the navel itself?
Proper umbilical cord disinfection protocols. This is direct action. as soon as possible after birth, that umbilical stump needs immediate and thorough disinfection with an effective agent.
Like the 7% you mentioned.
Exactly. That's a common, effective choice.
Yeah.
Dip it thoroughly. And if the calf is in an environment where it might get dirty again quickly, repeating that application daily for the first 3 or 4 days is a good idea.
Then crucially.
And crucially, remember what we said earlier. Avoid clamping the navel stump. Let it drain and dry naturally after dipping. Clamping can trap bacteria.
Got it. Avoid clamps. What else is key for prevention?
Thinking about the bigger picture. Strategic management of dystocia and dam health. Try to minimize difficult calvings through good cider selection and heifer development. Maintain cows in that optimal body condition score range we discussed. Not too thin, not too fat.
Because healthier dams have healthier calves.
Generally, yes. And provide extra attention and supportive care, especially ensuring colostrum intake and maybe extra navel dips for any calves that are born from difficult calvings because they are automatically higher risk.
Makes sense. Anything else?
Finally, just ongoing monitoring and early detection programs. Even with the best prevention, cases can still occur. So daily monitoring of calves, especially during that first week, is vital. Using calf health scoring charts or even apps can help standardize observation. And regular consultation with your veterinarian is key to review your protocols and refine your prevention strategies based on what's actually happening on your farm.
Okay, so if we connect this back to the economics, it seems crystal clear. The cost of prevention, the iodine, the clean bedding, the time spent ensuring colostrum intake must pale in comparison to the cost of treatment, lost growth, potential infertility, or losing the calf altogether.
Absolutely. The economic argument for proactive prevention is overwhelming. The direct costs of treating severe cases, vet bills, drugs, potential surgery, plus all those indirect, often hidden losses from reduced growth and future productivity issues. They far, far outweigh the investment in robust preventative measures.
So investing in prevention isn't really a cost, it's an investment with a potentially huge return.
Exactly. It provides a really strong economic rationale for producers to shift their focus from being reactive, just treating sick calves, to being comprehensively proactive in preventing the problem in the first place. It improves welfare and profitability.
Okay. So wrapping this all up, what's the big takeaway for everyone listening? It feels like navel ill is much more than just a minor calfhood issue.
Definitely. It's pervasive, it's economically significant, and its ability to progress from that local infection to severe systemic disease really highlights a critical vulnerability in young calves that demands serious attention.
And while looking for those external signs is important, this deep dive really hammered home why advanced diagnostics, especially ultrasound, are so often indispensable. They're key for getting a true diagnosis and making sure the treatment actually fits the problem.
Absolutely. But to reiterate, the most powerful tool we have is proactive prevention. That holistic strategy, meticulous hygiene, gold standard colostrum management, proper umbilical care, that's where the biggest impact lies.
It's not just about animal welfare, though that's critical.
No, it's a direct investment in the financial health and long-term sustainability of the whole cattle operation. It shifts the paradigm from costly reaction to predictable, managed prevention.
So I'll leave you with this final thought to chew on. How might these principles we've discussed, proactive, data-informed prevention, and really understanding the impact of subclinical or hidden issues, how might they apply to other problems you encounter? Maybe in animal health, maybe human health, or even in other complex systems in your own life or work? What hidden costs might you be overlooking by only reacting to the symptoms you can easily see? Thanks for joining us on this deep dive. Keep exploring, keep learning, and keep asking those important questions.